Hi, this is Dr. Sosa again, talking about morbid obesity, bariatric surgery. Today, I'm going to touch on the topic of supplements. I have my bariatric surgery. What supplements do I need? What do I need to stay healthy? So, there's a bunch of them to talk about. So, let's start with the key, bottom line, basic, the roots of the tree, the multivitamin. It is absolutely essential to take a good multivitamin every day after you've had weight loss surgery. With the gastric bypass, you get more malabsorption of multivitamins. But actually with the sleeve, you get pretty bad absorption of what we call B12 or the B complex. So with both of them is very important. You have to start with a good multivitamin. Now, I'm not going to name brands, but common brands are not good multivitamins. They have what is called the recommended daily allowance, which is how we measure the percentage of vitamins you get. I'll give you an example. If you take 100% of the RDA, recommended daily allowance, but you're only absorbing 10%, well, that vitamin is no good for you. So a classic, typical good vitamin is not a good vitamin for a bariatric patient. You have to take a special vitamin that has higher recommended daily allowances. For example, our vitamins in the B complex has 3,000%, 4,000% of B1. Why? Because you're going to absorb so much less that you need a much higher percentage. There are multiple good bariatric vitamins on the market. We use our own, designed by us, but the key, the roots of the tree are the multivitamin. What else may I need? Let's talk about one of the more common issues, iron. Both with the gastric bypass and with the sleeve gastrectomy, you are going to absorb a lot less iron than you typically do from your food. So you must supplement your iron. That is especially important if you're a young woman in reproductive age who's having periods. Every month you're losing a significant amount of iron. If you're absorbing way less from your food and you do not take an iron supplement, you are going to get anemia. If you ignore it for months and months and months, the anemia can be so bad, you end up in the hospital. About once a month, I get a patient in the hospital who's 2 or 3 years post-op, is not taking anything, and now they have such severe anemia, we have to bring him in the hospital, give him the iron IV, sometimes give him transfusion. How do we prevent that? You take your iron supplements. Now, if you're an older person, if you're a male, you may not need iron supplements. We check you every 6 months. But if you're a young woman of reproductive age, there is no doubt you're going to need iron supplements to prevent an issue. What's next on the scale? So we have the trunk, you need your iron. Let's fill out the tree. What else do you need to have perfect healthy nutrition? Let's talk about one of the biggest issues, not just in bariatric surgery, but across the US, vitamin D and calcium. To have the right amount of calcium in your bones, you need to have right levels of vitamin D. Vitamin D is generated by sunlight exposure. It is also generated by using your bones to get the calcium into your bones. Now, your level of calcium in your blood may be normal, but the calcium in your bone may be low if you do not take your vitamin D calcium supplements. Osteoporosis, or even the more severe form called osteomalacia, is very common in the US, especially in older women. So now I've done an operation on you that decreases your vitamin D and calcium malabsorption, so you are way set up to develop a problem. And it is almost universal that when I check my folks' vitamin D and calcium, the vitamin D is low. So you have to be on a vitamin D calcium supplement, especially if you're a woman, because the rate of osteoporosis in women in the US is very high. Now, if you get a lot of sun, you're an athletic person who uses your muscles, works out in the gym, you may not need so much or any vitamin D or calcium, especially the young, healthy, strong men that end up working out a lot. But most of us are going to need vitamin D calcium routinely, and especially if you had bariatric or weight loss surgery. Two other ones that I'm going to touch on, because everybody asks about it, is biotin and protein. I'm going to put them together because it has to do with your hair. So biotin is a big complex that is very helpful for hair growth. And people go to me, well, I'm losing my hair, I'm going to take lots of vitamin. Well, it's good to take biotin, but it really does not fix the problem. Why? If you have significant hair loss problems with your nails, the real issue is protein. You need to take your protein supplements. So you've had bariatric surgery. The first few months from your diet, you're going to consume very little protein. You're not going to be having steak or burgers. You're going to be having soft, mushy food that typically does not include a lot of protein. So it is very important the first few months after bariatric surgery to take protein supplements, usually in the form of shakes. Further and further away from the surgery, you can have protein bars. Classic sign that you're not getting enough protein. Your hair is falling out and not being replaced. Your nails are not growing and getting brittle. So you need to increase your protein intake. Protein, biotin go together for good hair after weight loss surgery. You will have issues with protein deficiency in both the gastric bypass and the sleeve because the type of diet you're going to be the first couple of months. So get used to taking your protein supplements, usually in shakes, later in bars. Very important part of the postoperative nutrition in bariatric surgery to stay strong and healthy.